see
My
how that.
sister's like, we need to know, my sister thinks we're talking about the shoe list. And that's
Well,
why she's
yeah.
telling that whole family. And she goes, the Facebook post says shoe list. I go, it's not about that tonight.
We're gonna tease the shoe list.
I know, but they
For
think
people
we're
that
going
wanna
into
see.
depth about it.
Oh, we're not going to
No,
get to that.
it's a sneak
Yeah, that's
peek
why.
on the
Sneak
shoe
peek.
list.
There's a
That
video
means
of
a
all
little
that
snippet.
you did already on it.
Well, we are on. I don't know if anybody is watching. There are 9 people that are already watching.
Hey, hello, everybody.
So
Where's it show them at?
it just says up here, right?
But you don't know who they are.
No, not yet. Until they comment. So if you're here, you can comment. Let us know you're here, so we know what's going on. So this is something we
Oh,
decided
hi,
to do.
Susan. We see you. We
Ah,
don't see
yeah.
you, but
Oh, there we go. Now we're seeing some things.
There we
people are.
go.
So thanks for showing up. We just wanted to have a nice little casual conversation amongst us that we would let you guys in on, so that you get to know who we are and the history of the clinic, and hopefully we can answer if you guys have questions. We got the chat going, so we can answer questions as we get going along, and hopefully we have a little bit of fun. So we got drinks, we got snacks. If you guys want to drink. Let us know. Don't say anything weird on the chat, but we just wanted to do something that's a little different, a little fun, and just to get you guys in. If you're not live, hope this will be on YouTube later on, so maybe you're not watching it live, in which case we're not going to answer your questions because it's past. So to start with, what I thought we could do is just to give people kind of a history of the clinic, is to give us a history of us, because that's kind of the clinic. So I thought that we could just go around and tell a story about how you got here. How did you get to the clinic? When did you start? What brought you here? And then we'll kind of go from Jason, who was here the longest, he's the old guy, to Ann, who's the newest one, and just kind of that can tell a story about how the clinic has kind of evolved over the years. And that story helps us out with why we do what we do. So if you interact with us, you know why we are kind of who we are. So tell us how you got here, tell us when you got here, and then tell us what you're drinking and why.
I've been here going on 24 years. I knew Ron, little did he think that I knew him, but I knew him probably 30 years ago. I was a student athletic trainer at the university. He would always come down to the university and see athletes. And he'd always show up with these weird concoctions and weird exercises, something that was just kind of off the wall. So it always kind of caught my eye. I'm like, what's that guy doing? Well, lo and behold, a lot of these athletes would start improving or show improvement with what he did. And so then the thing that really caught my eye was the balloon exercise. He came down there with a bag of balloons one time, and he was showing an athlete how to blow up a balloon.
So this is like in the late 90s?
This would have been the early 90s.
Early 90s, okay.
So back when our football team was really good.
Got it.
So he was doing that, and then I always kind of kept my eye on him because it was just something different. And so I kind of followed him through that. I went to grad school in Minnesota, was an athletic trainer there with their football team. Then I went to PT school in Des Moines, and then I did a clinical with Ron back in my senior year of PT school. And he had just started the clinic up. That would have been probably like 99 or 2000, somewhere in there. And it just so happened that a classmate above me was working for him, and then he was leaving to go to the Miami Dolphins. And so then I followed suit, taking his position. So I've been here ever since. But as far as how
so compared to when the clinic started, in like
99,
99, and then you came on not long after that. So you've kind of been around.
So it's just kind of neat to see how things have evolved. I mean, from back, I mean, some people don't even know probably what I'm going to talk about, but he was really big into protonics back then. Lori knows what protonics is. It was you never call it a brace, it was called a system. And so he was really trying to promote that, but he knew what it could do, but it was more or less for patellofemoral pain or kneecap tracking. But he knew there was more to it, how to engage the left hamstring, but how the chain affected everything else. So he was really trying to promote that. And back then there was a lot of protonics courses all over the country. Ron would leave, he'd be in the clinic, Monday through Friday, leave Friday afternoon, travel somewhere, be back in the office on Monday. I mean, he did a lot of teaching back then. So it's really rewarding to see how much this is. I mean, the hard work that he's put in and what he's established and how it's evolved over, 30 years, 25, 30 years.
So I mean, this is all Jason knows is at the clinic doing this from day one. So I mean, it can really go back and get into the.
And then all these other courses have he's still working on courses. So
I think it would be good for people to understand when we're talking about Ron, we're talking about Ron Hruska, who started the Hruska Clinic. And Ron Hruska also started the Posture Restoration Institute, which is the science of the physical therapy we do in the clinic.
That came from, so he was doing
PRI.
Hruska Clinic exercises in the early 90s. He blowing balloons.
Even before that.
Before PRI existed, before the Hruska Clinic existed. So PRI existed to help teach what he was already doing clinically. So just so people know that PRI is kind of here because of the clinical nature of what we do. So that's why I wanted to say this was happening before there was even courses.
Sure.
So, and Jason's been around since, when there was one course, and it was just to try to get people to understand that.
What a left hamstring did.
Yeah. To a neck, right? Weird things like that. So PRI goes way back, but Jason was here since the beginning. The clinic goes way back.
Yeah.
The clinic was a different location. It was has it moved a couple times? I mean,
well, we were behind. I know before I came, it was at some other different location. I don't know where that was at. Then we were behind Target on 48th and R on the second floor. And then when we built this clinic, we had to go to a transitional clinic because our building wasn't constructed at the time. So we were at a temporary building over on 70th. And were you here yet?
I was just this building was being
2006.
completed about a month before I started here. So
we
you
were
guys were
right across from Lincoln East,
right.
Taylor Meadows. And then we moved here.
So when did you get your Jason?
I got here in 2006. So I'll go back a little ways further. I've had a lot of people ask me, well, how'd you get into PT? What was your path? So I'm going to go back a little bit further and tell that my original plan in life was to be an architect. I was like drawing, working with my hands and things like that. Didn't take me too long to realize I was never going to sit at a desk all my life, and did a lot of blue collar work. And somewhere in the line, decided, I'm going to go back to school, do something different. My wife encouraged me. And I still to this day don't really know why I picked PT, other than I just kind of felt led in that direction. But while I was in undergraduate school, I was working full time during the day, and I'd take night classes, and I started having some sciatica pain. And so I went to my doctor and was telling her what was going on. She says, well, you need to go to physical therapy. And I said, well, that's great. I'm hoping to get into PT school. And she goes, oh, well, you need to meet Ron Hruska. So I didn't know anything about Ron. I didn't even know anything about PT, to be honest with you, at that point. But she sends me over here. And the thing that I remember, this is when I was still over at R Street, is I fell in love with the atmosphere of the clinic. Everybody seemed like family. Everybody got along. There was, it was just so lighthearted. People seemed to care. And you'd walk in the door, and whoever was at the counter at the time always seemed to remember the patient's names, and just, it was so welcoming. And I knew I wanted to be a part of it. And so I just kind of kept in touch with Ron throughout the whole process, and knew I wanted to be a part of this atmosphere. I don't think I at that time knew anything different about the practice of PRI compared to anything else.
Yeah, it's all you know.
It's all I know. It really is. So
He knows other things.
Well,
PT wise.
This to me, sometimes it shocks me when I talk to friends that I went to PT school with and realize how different they practice. And it's that still the model of, well, you go in 3 times a week, whereas that's not what we do here. We try to help people become independent with their own home program and not have to come in over and over and over and get exhausted and sick and tired of seeing us.
And if you talk to those people, it's a whole different vibe. It's a different,
it is.
The burnout rate for PTs is pretty high.
Right.
And when you're working in those clinics where you're seeing 20 patients.
Right. And here you've got Jason, who's been here for 24 years. I'm closing in on 19. Lori's over 18, closing in on 19. You've been, and that's just here. Lori was practicing.
So yeah.
Yeah.
We'll get,
So, but that's just kind of how I got here. And it was just one of those things I felt like my place was here. And about the time I was graduating from PT school, Ron had somebody else that was going to be leaving and going. He was originally from the East Coast and was going back home. So a position opened up for me here.
Yeah, so the two of us have been here. That's all you know.
Right.
That's PRI.
Yeah.
Wrestling the whole time. So they're, rocks. I mean, they just know everything that's going on. They've been here forever. So, Jason, you can tell us what you're drinking.
Voodoo Ranger.
Why?
It's beer.
He's a Voodoo Ranger. He's
It
Voodoo.
was on sale. He was at Hy-Vee.
That's Jason. That's Jason. He'll pick up what's on sale. It doesn't matter. Doesn't matter what it
I'll be mad at you.
is. He does Voodoo. What are you drinking?
I'm doing a Moscow Mule mostly because I have a sweet tooth and it's a ginger beer, which is basically
And
hot.
this isn't your ginger beer.
This is
made
not.
yet.
I make my own ginger beer. I'm
I was
new at it.
hoping that maybe you were going to use your own ginger beer.
I actually planned on it, but I don't have any more right now.
Okay.
It takes a few days for it to ferment.
Okay.
So
Good deal. So, and then, Nora, you started not long after Dave, right?
Yeah. He started in May and I started in September.
But you worked elsewhere before you were here.
Yep.
So how'd you end up here?
So I actually knew Ron when I was in 1995. I did my last clinical rotation. He was the director of physical therapy at St. Elizabeth's Hospital. At that time, I mean, he was talking about the upper quarter and the lower quarter, and the lower quarter became our myokine course, and the upper quarter became postural respiration. But anyway, that's the start. Early.
Yeah, I
PRI.
think before PRI was
Yeah.
PRI. He, I mean, that's what, and if you talk to Ron, he's been doing this since he was,
I remember as a student, Ron had me go, we would have gotten taught in physical therapy school, and Ron goes, well, I see a tethered medulla oblongata. And
If you know Ron,
yeah.
that makes
And
sense.
so after that, I'm like,
Carlos
I'm getting ready to
Martin.
graduate in May, and I feel not very smart at this point in time. I think I signed up for my first continuing education course 2 weeks after I graduated from PT school. But fast forward, my husband and I moved up to North Dakota with this job at UPS. And when we moved up there, I was doing home health care at the time. I worked in rehab. I did a lot of pulmonary rehab. I helped wean people off of ventilators. And I loved the geriatric population. I loved going into people's homes and doing one-on-one care. And when we moved up to North Dakota, they did not have any openings in home health care. So I was put in outpatient. And if you would have asked me, I don't like, it was not my love doing outpatient physical therapy. And so I had to get to a continuing education course to get up to speed, because by then I'd been out of school for 7-8 years and you get behind. And so I went to Minneapolis and I went to my first PRI course where Ron was teaching. And it made me look at the human body completely differently. And I took that information and I had great outcomes with my patients. And on top of that, I was a runner with chronic hip pain for 5 years. And all the orthopedic doctor could tell me to do was to quit running. Despite, I had an MRI, a CAT scan, a bone scan, an x-ray, and no one could figure out why I couldn't bear weight on my leg. And all I get told is everything's okay and don't run. And so when you're in your late 20s or early 30s at the time, that just didn't sit well with me. So after I went to that first course, I came down and to see Ron as a patient. And it was the first time in 5 years I didn't have hip pain. So just seeing the outcomes that the science had for my patients, but also me professionally, sent me on the track of doing all my continuing education with postural restoration. I got certified, and when I got certified, I was asked to help be a lab assistant in South Dakota, and it was for our neck course at the time, and I was really nervous. And later that week, after I'd helped be a lab assistant, Ron called me at home, and I really thought he was calling to tell me what I did wrong with what I did with being a lab assistant, like he was going to try to correct me or something. And he actually called to ask me if I would ever consider moving back to Lincoln and working with him at the clinic.
can I interrupt you? 'Cause
Yeah.
I'm going to tell you something. I always assume you know this, but I don't know. So Lisa that used to work here, after that course, Ron was basically saying how impressed he was with you and what a great clinician you were. I mean, he was raving about you. And Lisa goes, well, why don't you hire her? I don't know if you knew that.
I did not.
I think I was
well, now we
assuming you
know.
did.
There we go.
Yeah.
So he called me, and my husband's job at the time told us where we were working. We didn't tell his job where we were working. So after 5 weeks of contemplating it, my husband decided to put in his notice with his job, so we could move back to Lincoln, so I could, what I call working at the Mecca. It was kind of like, if you go, like, it was like going to learn golf from Tiger Woods or something.
Yeah.
And so to have the opportunity to come back home and be closer to my family, but on top of that, to work with Ron and be mentored by him. And that's why I landed here.
That's awesome.
And I'll end my career here in 4 years.
Got 20 people. AT is on. I don't know if anybody knows AT. She's so I think that says, is that what that says? Hi, this is AT. Hey, AT, how's it going? Jim Cooper he's always around. Kara's from South Dakota. Hey, Kara, and Carla, of course you're in town. Me and Carla would be on. Big fan. So after Lori, when did you start, Lori?
I started in September of 2006. So Dave started in May and I started in September.
2006. Well, I was first exposed to PRI at one of those protonics courses in 2000. So again, back when it was nothing. Yeah. And I just graduated PT school and realized really quick I had no idea what the hell I was doing. Right? You get done and you just go, I have no idea what I'm doing. So I had a coworker said, well, you should go take this course from this guy from Lincoln. And it was a protonics course about use your hamstring for patellofemoral pain. But it was what hooked me wasn't patellofemoral pain. It was that then he would say, well, here's what happens to your neck. So all of a sudden, again, you're hooked. That somebody finally has an idea that the whole body is connected. It's not just a knee or a hamstring. So then you kind of have a reason. Now I have a reason why I do what I do. Because I just tell people in PT school, I learned a lot of what to do, but I didn't learn any why I did any of it. So I get done, I have all this big toolbox of things that I could do, but I didn't know what to do with any of it. And so Ron was the first person that said, well, here would be why you would maybe do something. So I was hooked. Also up in North Dakota, so we got a good North Dakota connection here at the clinic. So we got South Dakota online, but no North Dakota yet, but that's okay. And which is where I went to PT school and where my wife is from. And then we were living in North Dakota, and my wife's parents decided to move to Arizona. So we're like the only people left in North Dakota. We're like, why in the heck are we going to stay in North Dakota? It's cold. Just for what it's worth, it's cold. You know this. We don't know. People in Nebraska.
People, but I don't know why anyone.
People in Nebraska don't really know what cold
there.
is. Yeah. But North Dakota doesn't know what hot is either. So for what that's worth. So we started thinking we wanted to move. So we're thinking, well, where should we move? We should move south. We moved here for the nice weather. It's true. And so this is about 2011 or so. And I just started looking and I said, well, what would be cool with it? And I've been taking courses. And so I did some here. Nobody else up in North Dakota.
Did you work in Sioux City though too?
I worked in Sioux. That's where I worked initially right after PT school in Sioux City. So that's where I was. So Jane was the one, Jane Stanley in Sioux City, if she's watching ever, was the one who said you should go to this course. So Jane's been around from the beginning. She's a PRC up in Sioux City. She's the one who works with Paul.
Yep.
So she's the one who kind of hooked me onto it, but nobody else up in North Dakota wanted to really do it. So I'm on an island a little bit. So people were, treating and using PRI, and you have people around you that don't know it. It's challenging because you're trying to do things completely different to other people that are around you. So it was rewarding because I had different outcomes. It was frustrating because nobody else cared. Management, so, and I was in a hospital, so I thought, man, it would be cool if I could work at the clinic. So I just look up online. Back, internet was a thing by then, by barely, I think. And sure enough, they had an opening. You guys had an opening, so I applied and flew down and interviewed with you guys and Jen. For whatever reason, you wanted to come. I am drinking, just for what it's worth, for telling stories. This is a alcoholic butter beer. So if anybody knows Harry Potter,
stick of butter in there.
This is a butter beer, and I picked this to drink to tell a story because since we've been here, well, we had 3 kids before we came, and now I have 5 kids. So we have lots of kids who love Harry Potter. So my last 2 years of life has been listening and watching and reading Harry Potter. So I wanted to have a little Harry Potter drink. So this is for my kids, not for my kids. They don't get to drink it. But I get to drink butterbeer and be on YouTube, which is exactly what my kids would want, would be to drink butter, not alcoholic, drink butterbeer and be on YouTube. So I mean, that's for my kids anyway.
I forgot. I'm drinking sparkling water. I
Dry
love my
January.
Bubbly. Yep.
Her bubbly.
Yep. I'm
Not
drinking.
bubbly. Too many butterbeers.
Right.
But when I came on in 2011, Ron was starting to want to back out of the clinic. He was doing more work with vision, so he was spending more time in PRI vision, which was a thing at that time. He was doing more stuff trying to back away from patient care. So that's why there was an opening because he was trying to back him. So I say this from the beginning when I worked here, my job was to try to take Ron's place, which is like a little wild. Not that anybody can, but that was when we were starting to work a little bit more with integration. So when I started, and you guys were before that, I mean, there was some integration. You were working with dentists,
Right.
but it wasn't like it was a huge
It wasn't like
piece of the puzzle.
It's not like the team we have now.
Yeah. So
Was
About
the
that
building
time-
at that time, have we added on?
hadn't added on yet. So that I think that was in the works maybe.
Okay.
But there were, I think Heidi was here a couple days a week. So there,
Mhm.
it was just kind of in that process of starting.
Right.
So when I started working here, that's when we really started getting into, vision and dentistry and so that morphed eventually into our prime program, which we can talk about eventually when we get there. But I know for you guys that were here before I was, that wasn't, so that's all I know is that when I started, that's what we started doing. So
We did it prior to you, but we didn't have the
But
prime.
It wasn't the program,
yeah.
right.
But that's kind of just really starting to ramp up. And again, I didn't do that at all before I was here. So but I know that that's when that started to really kind of take off. And then we were pretty consistent as a staff for a long time. And then we needed more sanity in our lives. So at some point, our first live stream ever was Ann. It wasn't a real live stream, but it kind of was. It was interviewing Ann
Yeah.
in this very
It
room
was.
Yep.
during the pandemic, right?
It was 2021.
Yeah, 2021.
Yep.
And I don't remember. You had Ann in a course,
Yep.
and they said if we're ever looking to hire, there's this gym down in Arizona that we should be in touch with. So you can. maybe
Yeah,
start, 'cause
well,
it was a. I'm sure.
it was-
I'm sure we impressed you with our live stream presence.
Yes.
There was
yes.
no drinks because it was 8:00 in the morning.
Yeah, it was
We're
6
still
o'clock in the
seeing
morning my
patients.
time, and I was 7 months pregnant at the time. So my laptop was literally on boxes of diapers. So that's how I interviewed. But I was actually exposed to this in 2008. I was a patient here after I broke my neck. I had seen countless doctors. I don't even remember. Because I was still struggling, and my aunt's a PT here in town and was like, you should just go see Ron. Like, it's going to be something totally different. Like, let's just go there, whatever. So my mom, I think she was still driving me. Like, I was up in Wayne for undergrad because I just felt miserable. So I was like, I don't even think I can drive 2 hours to get here, do an appointment, and then 2 hours back. So I came, sat in room 4 with Ron and everything, and was just like, what in the heck is all of this? Like, this is crazy. I already knew I wanted to go to PT school. I think right after that, I found out that I had gotten into Creighton for PT school. So, but I was kind of one of the probably earlier integration ones. I saw dentists, I saw eye doctors. It was definitely different than how it is now. So I've kind of been a frequent flyer. I come in, I come out, patient-wise and everything. But after I graduated, I went to Arizona, to Phoenix, to start practicing, and kind of got my feet wet, but always had this in mind. And then I started taking classes. Then I moved to Australia. My husband went to grad school there, so dove in even a little bit more over there because they just practice different here than in the States. And then came back and took the class with Lori down in Tucson right before pandemic struck. And yeah, was not expecting anything. I told my husband, because he's from Arizona, like the only way I would ever move back to Nebraska.
And she's Nebraska.
And I'm from Nebraska. I'm a native. Like,
Columbus folks on that side of the room.
yeah. I said the only way we would ever move back to Nebraska is if I worked here. And then you guys called and we came back. So this weather, granted it's nice today, but the cold, I question why I came back every single
See,
time.
I'm rooting for the next
But-
winter. She dreads the winters because
The winter is
because they're
very
out here.
hard.
Yeah.
So
Carla
Yeah.
said that 2011.
2011.
So
That's when
much
she
has
started as a
changed.
patient. So much
Yeah.
has changed.
It was.
Yeah, and
Yeah.
yeah. Since when a lot has changed, and it's
Yeah.
but it's become a little bit more again. Now you know it's a lot more streamlined. And you went through the Prime program, so
yep,
you saw
yep. I've been
that.
with
Lori is a
Prime.
PT, right? I mean,
Mhm.
so
A lot of the reason why that kind of streamlined is that we would get patients that would come in from other physical therapists.
Mhm.
And when they would come in, the physical therapists were doing great work. It's just that they needed more of integration, whether it be with the
For the
dentist. And so
resources.
people were spending like an airplane ticket or time to come in.
Mhm.
And then we realized they needed those integration appointments, and then they had to make another trip back in. So we started to streamline the process so
Yeah.
people were to be more cost effective with people's time and money. So we had those appointments set up, and that's why Prime came around.
yeah.
Yeah.
People
Well, and
piecemealing it in different areas and
Yeah,
and
and
different things and
Like when I went through vision and dental the first time, like there was
it
no
wasn't-
PT
It
there.
wasn't a
Like
Prime
it
program
was,
thing.
it was literally Ron would send a note over or call over. Okay, here's this. Like, oh, this is what I found. Then you'd wait, and then okay, like I'm gonna go get this. Let's check it out. Come back in. Like it was a lot, like you said,
Yeah.
back and forth and back and forth, to see what was going on. So
So that program's really kind of built over the years, and we can dive into a lot more of those kind of things.
When was Prime
As we go.
really established though?
I think our first like official Prime like website thing was in
2015?
2014. We
Yeah.
actually started
So about-
like calling it that. But again,
10 years.
we've been doing it piecemeal
Mhm.
before that. But that's when we kind of sat down and said, hey, well, let's actually bring people in. Let's do it all at once to make sure it's all done right and
Yeah.
go from there. And so, and even since 2014, which is now 10 years.
I know.
I think that program is streamlining more and more as we go along too. So, if anybody has questions about what they want to ask us, go ahead and throw those in the chat. And you guys are doing great. We got 21. It's good to have people wanting to see where we're at. Some things that people wanted to know about ahead of time, because I had people call, was really, and it's a perfect segue for us to kind of tease it, was we get so many questions about shoe list and about shoes and that whole thing. And so, of course, we teased it because that gets people to actually show up and watch. Christy's up
Christy's
there.
on.
Hey, Norfolk. Susan's got a nice comment. I thought Christy would be on. Good to see Christy. I'll send you an email soon, Christy. You know what that's about. I can't read that miser. Pretty bad. I should see that.
Susan, the integration is so key. I was so much less scared when I had one of you with me. I felt like you were the only ones that understood me. Robin, thanks for the intros and history. Really appreciate the work you all do.
Well, thanks. That's really nice comments like that. So we want you guys to be able to know what we do and who we are, so that people do feel like Susan's safe about coming to see us. Because we, like Dave said, it's an atmosphere that we can sit around and have drinks on a Wednesday night. We don't do it during the day. Don't worry about that. But it's a pleasant environment. We want to help people.
Right.
Right? We want to help the PTs that send us patients. Like, we just want to help people, right? So that's what I think what drew you before you worked here.
Absolutely.
And that's why that when, in however many years, 25 years, you can count on two hands the number of people that have worked here as a PT. So anyway, so we appreciate all that. But the part of that story of really what got things going even for Prime was the shoe list. When you found out that shoes made a big difference. So why not? And I know you've told the story so many times. When did the shoe list start? How did it come to be? And why is it a big deal? Because obviously it's a big deal. People, that's the one thing that, not the one thing, but that's one thing that people really know us for.
Lori, for the marathon runners is
There are a mile number out there when it's time to retire a running shoe.
300 to 500 miles, Christy. So most shoes will last 300 to 500 miles. I know I'm old school when I say this, but when I could buy a pair of running shoes back in the olden days, you could buy a pair of shoes and they'd last for like a year.
Yeah. It's a lot
They
less
make shoes
now.
out of different material, recycled materials. So most shoes we're finding are only lasting 3 to 4 months. Depending if people are wearing them all day, every day, and taking a lot of steps. I'm like, who's counting how many miles they're walking in a shoe every day? So I would say most shoes start to break down after 3 to 4 months.
Yeah. And that's why I think a lot of people that train will actually kind of rotate shoes.
Yeah. I
So they
rotate
don't-
shoes. I have 3 pairs
Yeah,
of
so
shoes.
they're not
Yeah.
doing this with their shoes. They're kind of gradually kind of doing all those down. And I know Christy and I talked recently about marathon training
Yeah.
and the difference between a marathon training shoe and maybe a marathon competition shoe. And if you have a different thought for what you would maybe compete in versus maybe what you
Lori
would.
Thompson's thought. I don't know why people would run like in a flat racer shoe because it doesn't support your foot running. You know what I mean? And I know sometimes runners
Especially
they
for training.
want they want a lightweight shoe, but why would you go run 26 miles in a flat rep that doesn't support your foot that can cause your body not to be in an optimal position to get power and push from a butt? That's just me. But that's just me. If you want to run in a lighter weight shoe, you can, but I don't think it's not like we're talking Olympics or something that, it's seconds.
Yeah.
We're talking little seconds. I'd rather run a
Is
little
it-
slower.
That's the question. Is
And feel
it,
better.
You know what I
Is it
mean?
worth
And,
it?
and be able to run multiple races and run one race to gain maybe point whatever seconds. And I don't know. I don't get that. I'm a runner. I always do what shoe supports me.
Yeah.
So
I know you just had a triathlete that came in with a competition shoe
Mhm.
that was
Like a
supposed
carbon
fiber,
plate
like
and
$400 running
Nike-
shoe.
Yeah, it's
that-
a Nike shoe. The middle is missing.
yeah, really
It
expensive,
was
good, a really high quality competition shoe.
Yeah.
And she was miserable.
Miserable.
But-
She
And
went
what
to
did-
Brooks.
And what does she
Adrenaline.
run? Yeah, now she runs into Brooks Adrenaline for
She's
triathlons.
Ironmans.
For Ironman trials. So you can do whatever works, but it's just about
Yeah.
feeling good.
it's just about keeping the body in harmony that the left and the right side can
Which kind of goes back to, okay, so how did the shoeless all, why do
Okay.
we even care? Why did Christy even ask the question? Because Christy knows. So tell us the shoeless story.
So the
Just so
funny,
it's on video.
Ron and Jason, we always paid attention to shoes. But I had a runner, we never had a shoe list. And I had a patient, she was a dental hygienist and a runner who came in, and from a physical therapy or from what we do in our clinic, she tested out great. She was neutral. Her list scores were 5 out of 5. She had great pelvic and hip stability. She should have been pain-free, and she was, except for when she ran. And I was just trying to figure out what I was missing, that she was still having knee pain, because all of her objective tests were so much better than when we started. So I happened to ask her if the shoe that she came in to see me in, because she'd always come in her scrubs and she would come in tennis shoes. And I assumed that the shoe she came in to see me in was the same shoe she was running in. It wasn't. And so I asked her, I go, well, how fast can you get back in here? And I think I actually stayed late the next night. And she came in and she was, I'll
I'm
never
sure she
forget,
did.
it was the Mizuno Inspire shoe. And the Mizuno Inspire shoe is a shoe that
gonna
is like a
remember
donut, and the outside of the shoe is down here, and the inside of the shoe is here, and it kept her on the outside of her feet, that she literally could not shift into her hips, and her pelvis couldn't move back and forth. So she was overworking her hip flexors and overworking her back extensors. I literally had her walk up and down the hallway with that shoe, and I laid her down, and all of her objective tests that were negative were now positive. And then I had her put on her shoes she came in from work with, and she'd walk up and down the hallway, and all the tests were negative. So I went and I got Ron, and I go, you have to come see this. And so he came back into the room, and I showed him, and he goes, I wouldn't have believed it had you not shown me.
Which he doesn't ever say.
Yeah.
Like ever.
So that's where the shoe was started. So we started paying a little bit more attention to how shoes can really be impactful with our rehabilitation process with our program. But I want everyone to know out there, you guys, shoes the goal isn't for you guys to feel like you're in shoe jail. That you have to be in this perfect pair of shoes all the time. The goal would be, and I know Susan, you know this because I tell you this all the time. Our goal is to have you guys have footwear variability. That maybe you're not wearing a perfect pair of shoes, but you have enough stability throughout your system that your system can alternate. That if you didn't wear a perfect pair of shoes, that your body isn't going to fall apart. So once you gain more strength and stability, do I want you to go sightseeing in Italy in a bad pair of shoes? No. But, you know, if you wanted to go out on a hot date with your partner, your husband or wife, you know what I mean? You could wear not a perfect pair of shoes and that would be okay. So
So it started, what, do you know about when that was?
it started in 2008.
Yeah.
After that, her name is Michael Ann. I remember her name. And after
And the
that, the
shoe,
shoe
the
list.
color of the
And we
shoe.
started putting out a shoe list every year.
That was when the foundation came out.
Yeah, so if you've been in our clinic recently, we have a shoe wall of fame
It was
out in our gym.
2006. I'm sorry, it was 2006.
2008 would have been the foundation.
And
We
then,
were stuck in shoe jail for a
I was
while.
stuck
Right.
in shoe jail.
Sorry,
for
it was
a very long time.
2006.
Yeah. And the foundation is on our shoe wall of fame that's out in the gym for all the shoes that you can no longer get. It's sad. It's a sad story. Sad story. RJ's on. It's good to see RJ. Thanks for commenting.
Glenn, see your comment. Hold tight. We are working on getting some brands for dress shoes, casual shoes for men and women to come out.
So that's Glenn's question is probably the most common question in some, which is,
capacity.
So,
you have
so,
suggestions for dress shoes, for casual shoes, for basketball shoes, for whatever.
so Glenn, we used to put out a casual shoe list. Jason and I actually went all over Lincoln and spent like over 16 hours looking at shoes. And we put the shoe list together only for that shoe list to be obsolete within around 3 to 4 months, because at the time, a lot of
so
casual
many.
shoes were selling out. Then the shoe store would get another shoe in like for spring or summer. They get another one in for fall. So they were rotating a
Changing
lot
all the
quicker than like athletic shoe was. And so just for the time and energy that it took to put that list together for it not to be relevant for 3 or 4 months later, what Ann is going to be so kind to do is to give out brands of shoes. Like Echoes is a good brand. Bionic is a good brand. That they tend to fit the criteria of having a good heel counter. The Echoes tend to have a good arch support. So we may not give like a type of Echo, but maybe some brands of shoes that we've had good luck with in the past.
Mm-hmm.
We don't like slip-on shoes because they don't have a heel counter.
And so that's why on our list, there's
Yeah.
all the qualities that we look at in all shoes.
Yeah.
So any shoe that makes it on our shoe list
Yeah.
from an athletic or a running shoe meets those qualities. And so we try really hard to say if you have a shoe that meets this kind of general guideline, it's probably going to be a good shoe. You only know if somebody can test you out of them.
And I was going to say, that was the thing that you've always said for years, is it still comes down to the person. You know, if you go to look for a pair of shoes and you're wondering if it's a shoe for you, hopefully if you've got a therapist available, hopefully one of us, if you're in Lincoln, we can look at you in the shoe and see if we think that's a good shoe for you. It's not just, the list just in and of itself isn't just, okay, it's written in stone, this is good for everybody.
It's coming out in May, right?
There's just a trend right now, you guys, that a lot of shoes are over cushioned.
Yeah.
And a lot of shoes are like rocker shoes. I mean, literally not only is the front part of the shoe coming up, but the back part of the shoe is coming up. So the heel doesn't even hit the ground.
Like a
This should
banana.
be flat back here.
So we spent an hour this morning going over a bunch of new shoes. Lori went to the shoe store last Friday, and it's gonna be fun. So just like sneak peek for overall, we said, okay, the shoe list this year is gonna be a little different. Primarily because there's not one shoe that we think is gonna be like
Best shoe.
the best shoe. For the we've always had at least one or two that we can rely on, and part of it because it's a swing towards cushion. So what we found this morning is that 3 people each had a different shoe that was their best shoe,
Yeah.
for different reasons, and that's what's going to be interesting for us as clinicians and for all of you out there is you're gonna have to actually maybe work a little bit to figure out what shoe it is. You have to try it on, which is what I know a lot of you are already doing. We're just gonna have to be more mindful of what we want to do. So
Michelle says Ron taught her how to walk in her cute heels for a wedding.
Christy would like to know a little bit about the Kimberly.
Kimberly's
Williams.
journey.
So just so you guys know, I did do a video today about the shoes. That video will be coming out. Our
soon,
shoes
the
will
shoes
be
are gonna
coming
come out
out.
soon. So I thought really quick, and this is why I grabbed 3 shoes. You 3 kind of had a different shoe that you liked, right? You three.
I didn't know I couldn't put my foot in it.
Oh, that's right. Jason's feet are too big. The shoe that Lori likes, that's a new shoe that's on our list.
But
No,
this is
this one's
actually
not
on
on
our list. So this is the A6 GT 2000. This is a version 13. I like the narrow heel counter because, and not only does the heel not collapse in, but it's a narrow heel counter to have for people that have ankle instability. It'll provide like a good heel hug, and that heel hug will help you to extend your hip.
The problem with it that Anne found that
It's
she didn't
too
like it
cushiony.
is that it's got some cushion on the inside. So for Anne, who's got some sensory issues as a prime patient, former prime patient, who still really loves to be able to feel the ground, to feel good.
Yep.
That shoe didn't work good for her, even though it's a great shoe for your sister and for people who have maybe narrow heels that have heel instability.
A couple of my other patients, like I tried all the shoes on with my patients just to get a feel.
Thank you, Susan.
In the past, we could prescribe a shoe and 90% of the people would respond very, very well to it.
Yeah.
We just don't have a shoe that we think universally is going to be like a blanket good for everybody is what we're trying to communicate.
So Anne prefers this shoe.
So this is the A6 2160. It brings back terrible memories of being in the foundation. There's at least some better colors, but
It actually kind
there
of looks like that old
is
foundation.
really almost no cushion in it. You can really feel the ground underneath you. I had Dave this morning test me out in 3 different pairs.
She doesn't like how it looks.
Yeah, I really don't like the looks. I pleaded with Ron for like 20 minutes to give me a different shoe besides the foundation. And this is the only shoe that I test out
So
well.
even though the 2000 has good qualities, didn't test out as well, too cushiony.
Yep.
You had patients that loved the 2100 that didn't like the 2160, right? So we're gonna have to test them out even though they're good qualities. And then Dave, what did you like?
We don't have the Brooks Beast in here. No, the Beast was
This
the
is
one.
the
that-
Ariel.
Okay,
It's
so
just
this
the
is
women's
the
version.
women's version. It's the Ariel. I like the men's version, the Brooks Beast, which historically is a shoe I don't care for because I felt like it was
Just
just
a brick.
it was a brick. Exactly the word I was thinking. And now they've backed that off a little bit. And I'm clearly not a small person. I've got a lot of mass to me. But even with that,
He's Mr. Beast.
even with that, I never liked the Brooks Beast before. But one of the things, despite that, I think when you watch people walk and listen to them walk, I'm not a person that lands hard. I don't know how other people would be, but I think about that a lot of times when I'm looking at people in shoes. Are you someone who lands soft or you land hard? And I think, despite everything with my size, I land soft, and so the Brooks Beast is a good shoe for me.
So that's one that you're going to try out, test out, and see. Works for him. And he tried a bunch on his feet, and that's the one that. So it's going to be a year where there's some shoes that we have been on the list, some new ones, but it's going to be a little bit more hit or miss this year. So look for Lori's video. It's coming out hopefully within the week. With kind of an updated list. But we wanted to give you guys a little bit of a sneak peek just because you showed up. So thank you so much for showing up. Christy she just showed out. Are we going to talk about Kimberly W's journey? It'd be something I'd love to talk about. Just because, and I know, Christy, I know why you're saying that. We don't tend to toot our own horns around here just because we just don't. But if anybody were to Google Kimberly Williams Paisley, she's an actress, Brad Paisley's wife, Father the Bride, ring a bell, was in Lincoln, and she just shared her journey about her vocal cord issues. It was in People magazine recently. She has a beautiful video that explains her whole outcome, and that might be something that we can talk about at a later thing about how we integrate and how we were able to help out with voice issues. But it's all the same sort of thing. But it's just kind of a it was a cool story just because PRI didn't necessarily fix her voice, but it got her to a point where she could get her voice fixed, so it's a long story.
And I think, and correct me if I'm wrong, but I think in the process, things that were not evident that was a problem became evident after going through the PRI program.
Yeah. So she was in Lincoln a couple times. She had glasses. She got, and we did dental work with her, and she was a great trainer. Erica's in Nashville. So if you're in Nashville, check out Erica Young. She's awesome. She's a prime patient of ours. She was just on, not to shout Neil Helen, but she was Neil just did an interview with Erica this last week about her experience with when she was here as a prime patient, and it's a great story about how she was able to go from, somebody that was impatient and in pain and headaches and couldn't move to, now she's, doing amazing things with these people in Nashville. So
I think it would be maybe a good intro, like we talked, is if there's stuff out there that you guys want us to talk about, we're open to it. I mean, this is just kind of the first one, and
we just wanted people to know who we
some
are.
feedback from you guys on what maybe interests you, or if there's a topic that might, want us to address or what have you. I mean, we got our things that we like to talk about, but
we could talk. I mean,
We could talk all day.
yeah, if you don't know us, we could talk, for a long time. But
The difference between prime and PRI.
all right, Michelle, good question, Michelle. The difference between prime and PRI. So PRI is the Postural Restoration Institute. It really is the institute. It's actually the building across the street. It's an organization that teaches the science of what we do in the clinic. So PRI is not what we do in the clinic. It's not an exercise. It's actually the organization that teaches PT is what we do. So
It's the
a
science
methodology.
behind what we do.
yeah, postural restoration would be the science.
Right.
The institute is who teaches the science, and the clinic and Hruska Clinic is who we actually do it. We actually treat patients. So, and PRI is great. PRI has a big following amongst practitioners. But the clinical aspects of it all comes through this building over at the Hruska Clinic.
And Prime is a program with what we do clinically, Michelle, for people that come in, whether they get referred here from another clinician, that they need interdisciplinary care from a dentist and optometrist or orthotic management, because they're not being successful with the conservative approach of just doing PRI techniques or physical therapy intervention of the science of PRI.
Yeah, so PRIME stands for postural restoration, which is the science. That's the type of treatment you do. Integrative, multidisciplinary engagement. So it's somebody that has to come in because they need help from more than one discipline. Regular physical therapy or PRI treatment is not enough to allow us to move forward. So we talked about earlier with people who come in for dental or for vision. And so hopefully in later videos we can talk about how those things kind of came to be and how we do all that. If that's things that interest you, let us know and we can totally talk about all that. But that program is PRIME. So PRIME is just a kind of an acronym that says for people that come in, that's technically a PRIME program, but we have patients that are local that are PRIME patients just because they need to go see the dentist, they need to go see the optometrist. So there's lots of PRIME patients that aren't going through PRIME. So it's just a way that we could kind of categorize and again streamline that level of care. So
Michelle, did that answer your question?
hopefully that makes sense. But it's a great question because now before I worked here, I thought PRI and Hruska Clinic were the same thing. And it used to be in the same building. PRI was in this same building. And so when I was hired here, I kind of thought I was working for PRI until I got here and realized that I wasn't. Not that it was a big deal, but not that I wasn't, but it was a whole different company.
So PRI, I explain it to people is what they go out and teach continuing education courses to other physical therapists, physicians, chiropractors about the science of postural restoration.
So this podcast or this thing would be, because this is clinic, this isn't just PRI stuff. This is, hey, we want to help people. We want to help other PTs help their patients. We want to help patients. So we don't want this to become a PRI teaching thing. This is hey.
This is a Hruska Clinic.
This is
us. We're the people that
we want to help you feel better. So that's what we're here for. So I just want to thank everybody that showed on. Karen Duran.
hey Karen.
Where do you see PRI in 5 to 10 years?
Okay, Karen Duran. I'm going to give a shout out. I love Karen. Karen was my mentor. I'm sorry. It almost made,
tell the story of Karen.
Well, no, Karen was with me at my very first PRI course in Minneapolis, and she sat next to me. And I felt like everyone understood all this science of this stuff that I was learning. And Karen gave me her name and phone number, and she has spent countless hours mentoring me. So Karen is a physical therapist up in Minneapolis. She is an amazing, amazing therapist and human being. And so anyway.
Thanks, Karen. Good to see you.
Karen, I hope PRI is continuing to grow. I hope it becomes more mainstream. to be taught in physical therapy schools and more mainstream instead of being out on the fringe. I think for me, that was some of the Kimberly Williams Paisley. I mean, all of our patients are equally important to us, whether they're a celebrity or not.
Right. Which
The
is why we
thing
don't
that
have
was
necessarily too
exciting
many.
about Kimberly's story is it kind of put PRI kind of mainstream out there to know that this is something different. This isn't taught at physical therapy school. And so it's our patients' word of mouth that I hope PRI becomes more mainstream in 5 or 10 years. And I think that it is edging towards that.
And I think our goal, Laura's on faculty of PRI, I'm teaching some courses on PRI. I think the goal of us as faculty is to make it more mainstream, make it more accessible to people, so that it's not that's something that's out there, right? And what it takes is, and that's fine, that's PRI's business, but what we do mainly is just treat whoever's sitting in front of us in front of our room, whether that's
Karen, where do you
Kim.
see PRI in 5 or 10 years? Karen was in the very first certification class.
She was with Jason.
She's been around since, with you.
Yeah, so Karen
So,
and Jason were both certified.
I mean, you guys have seen all this big growth with PRI.
What do you think, Jason? Where do you see PRI in 5 years, 10 years?
I don't really know how to answer that. I mean, things come up. I mean, you would never thought where we're at today would be where we're at. I mean, period. I mean, just things from something to, Ron would attest this, and Karen, you would too. No one would ever thought how the influence of a pelvis would have an influence on a knee, and he would get arrows in his back all the time just from talking about how you got to look at the pelvis and don't look at the knee, and caught a lot of grief. And now we're looking at vision, we're looking at, dental stuff. I mean, there's lots of things. I mean, it's just how all those little things kind of come together, and you got to chew off a little bit at a time versus just kind of throwing it. And that's where I think Ron, for many, many years, has had to hold back, where he couldn't really expose that. He knew deep down in his heart that there was stuff there, but he didn't have a lot of people backing him. But now I think, I don't even know how many people are certified now.
Over 100.
Yeah.
250.
It's exploded here.
And if you listen to Ron recently, he's not afraid to say what's on his mind, which is more the big picture. This is really
what it is,
how it works.
Yeah.
And it's just a framework that says,
The human body is so wonderfully complicated, and I think we continue to learn and evolve. And I think that
and that could be things
the
that we can
Institute
dig
and
into
clinicians-
more
Well, I
why
think-
we do what we do.
Right. I think what we'll see, Karen, in the 10 years is people practicing like you and we do is, we do integrate. We know that you integrate. We know that you work with optometrists and dentists. We know that not every PRI therapist is doing that yet, but I think as PRI grows, I think that will be the component. The integration will be with other practitioners is what you'll see become the common thing in years to come.
Yeah.
RJ
plus.
is 350 plus.
350 plus for certified therapists, which is that includes
Thank you,
PRTs
RJ.
and peers. Yeah.
So Karen said, we'd love it to see it taught in schools, and I'm proud of what PRI has done in 20 plus years.
Yeah.
And Karen, that's because of people like you. That's because of people like
he's got the AI
Christy Jingles is on here. It's all the wonderful clinicians out there throughout the country that
So
take the science, and we all work together with other therapists throughout the country. And
here's what I think just broad big picture is that PRI was one of the first systems that I taught, that I've learned, that actually looked at the whole body as a whole body. We learned in PT school piecemeal, and it's still taught piecemeal to doctors and to PTs, and knees are knees and hips are hips and backs are backs.
Right.
And I think there are more people out there that are searching for something that puts those dots together. And because PRI has been around as long as it has, it's going to be one of the foundational things. It's going to be for those people asking those questions. How is these things related? PRI is going to be at the top of that list. The other thing that people are really looking for is that multidisciplinary model. It's not just PT. It's not just dentistry. It's not. So what other framework out there actually acknowledges and even teaches that there is multimodal treatments that actually make sense and gives you a framework how to do it? Anything that comes down the road that says, yeah, hey, dentistry and vision work together, the only science that they can actually go back to is going to be PRI. So I think PRI is going to be a foundational process that all other programs down the road are going to have to kind of look back and go, that's a holistic approach, that's a multimodal approach or a multidisciplinary approach that's where it all started. So that's kind of where I see. I think there's going to be other people that are going to take PRI and they're going to do whatever they want with PRI and they're going to spin it and take it as their own, but it's all going to back up to that's where it started. So that's where I see PRI as kind of still the pinnacle of, if you're going to have a holistic approach or a multidisciplinary approach, it's got to go back to PRI. That's going to be the foundation to it. So that's really what I see as we go along. We could talk about AI all day, right? Dave has a better acronym for AI.
I won't share it.
No, I think it's great because at some point, actual intelligence is going to need to be better.
Oh,
than
that one. I thought on a different one.
Okay, yeah. So there are. I've had patients email me, "Hey, I ran my case through AI. Here's what it told me to do. What do you think?" Right? It's a thing. It's out there. But the bigger issue is what's feeding the AI, and that is actual
intelligence.
So you're never going to be able to have something, in my opinion, actually be able to integrate with and engage with a person in a way that says, I understand you, I can see what you're seeing, I can feel what you're feeling, and go from there. But AI is going to be a tool, it's going to be around, and it's going to help guide people in terms of streamlining how they get to where they get. So you could probably tougher it too. I could tougher it too. But that's a great question. Thanks everybody. Anybody else have anything they're really excited about? We end up going a full hour, which is.
I think if they have
ideas
or something,
great.
if they want to email or how
This is just an introductory thing. It may not be all 5 of us.
Yeah.
But
So when we do this again, it might be Lori and Ann talking about casual shoes. It might be Jason and I talking about vision. It might be Dave talking about our thought. I mean, if there's things you guys want us to talk about, you can email all of us. You can get on our website. You can comment on this video if you watch it later. Say, hey, next time you should talk about that, and we'd love to do it. We're hoping that we could do this monthly. Just even so we can sit down and talk. Even if you guys don't show up, we like talking to each other because there's going to be drinks involved.
Exactly.
So gives us a good idea. So, Christy, thanks.
Thanks, Christy.
Thanks, Christy. Appreciate you being here. So thanks everybody for being here. This is going to it'll end up being on YouTube. So if you see it and you got value on it, share it with people you know. And then the next time we do it, have other people come along. So thanks for hanging with us. Yeah, subscribe, like, that's my kids with their gingerbread. Subscribe and like.
and the shoeless video will be coming out probably within a week or so, I would imagine.
Yeah, it's taped. We have to edit it. We'll have to get the list all put together. So
is the
list is done.
Is the shoe list out?
It's done. It's just not out. So we will get it as soon as we possibly can. We'll get it to you guys. So thanks for joining us. We appreciate you guys again. And have a great night.
See you next time.
Thanks.
Need an end. Perfect.
Got to do that.